again. Welcome to the U21 University Mental Health Symposium. Really glad to be your MC here today. I am Stephanie. I'm also a research assistant professor at the University of Hong Kong and also a committee member of the International Association for Youth Mental Health. And I'm really honored to be here today because U21 is a very interesting, unique chance for leading universities across the world to really share their ideas and also put together the resources where we're all working towards the well-being of all staff and students. And today the topic is on evidence-based university mental health, and this really touches on the principle 4 of the U21 University Mental Health Declaration. And you'll all be hearing more about that very shortly, shared by Vivian Brown from Oregon. And to me, this is also a very meaningful occasion because I did both my undergrad and PhD studies here. And I have heard of U21 for a very long time, but as a student, back then, I think, especially now that I'm a staff here, I really did see all the developments that the university has been making towards improving the well-being of our student and staff body. And sometimes it's just like, oh, I wish I was a student now, because I can enjoy more of the services provided by our well-being resource center leaders, and also a lot of student initiatives happening here too. Another aspect also is that U21, especially this mental health working group, really emphasizes a lot of student-led initiatives. And this is also something that we're really encouraging. So we'll be having a lot of sharings both by leaders on youth mental health, including we have Professor Robert Dooley, all the way from Ireland, here with us in person. And we also have some student presenters who will be joining us in the discussion shortly. So without further ado, let us welcome our Dean of Student Affairs, Professor Sandra Z, to give us his opening remarks.
Thank you so much. We are very grateful to have participants both in the hall here and also online as well. I just want to say two things. Number one, my connection to U21 was back to the time when I was in Auckland University, where I was associate dean, looking after international relationship. And then I think another U21 connection lately was able to access the rapid review on mental health after the COVID. I found it very helpful, especially the intricate different layers of details from that work. For me, is very helpful. Number two, I just want to say welcome people taking part in this afternoon. I am particularly excited to have the opportunity to listen to work around the world. The way I like to conclude my opening is to say that I went to the presidential symposium yesterday and listened to the keynote speaker. I think he made a very bold statement. That sentence remains with me, saying something like, without students, we don't have a university. And I would say without students being the solution to the mental health challenges and issues, I don't think we are capable to deal with the problems as well. So exactly, I think that is where I come from, and I look forward to many presentations and also conversations and dialogues. Okay, thank you. Thank you for making it, and thank you for being here with us. Thank you.
Thank you, Simon. So before we move on further to today's session, we will have Vivian Brown from Oregon. She is the director of the Government Relations and Policy at Oregon, which is a leading youth mental health center that really emphasizes not just research and knowledge translation, but also youth participation and involvement. And she's also the chair of the U21 Health Sciences Mental Health Working Group. So she'll be giving us a lot more backgrounds and details about the whole declaration on university mental health by U21. She'll be joining us online.
Thank you so much. It's lovely to join you all here from Melbourne, Australia. I want to thank very much Gloria Wong and all the colleagues at Hong Kong University for coordinating this session today and for providing an opportunity to again promote the U21 Declaration on University Mental Health and Wellbeing. If I could just start today and just sort of check that the slides are working okay. They may not be, but I'm happy just to keep talking. I just wanted to start by providing a brief history for everyone in the room on how the declaration came about. So back in 2018, at the annual U21 Health Science Group meeting that was hosted by the University of Melbourne, there were 2 sessions held for the very first time at that meeting that had a focus on student mental health and wellbeing. At the conclusion of those very dynamic sessions, with lots of audience engagement, the attendees there proposed that we should be doing some further work in this space, particularly looking to do some work to undertake a description of a set of principles or commitments for the U21 network to commit to that would continually improve mental health and wellbeing supports and experiences with the member universities. So following that, a mental health working group was established and we took a set of principles on university student mental health and wellbeing to the U21 President's meeting in May 2019. At that point, we were really seeking a conversation and hopeful endorsement of the principles we'd already drafted, but probably more realistically, while there was support for the work from the presidents, they did ask for some further refinement of these principles and to seek further consultation right across the U21 network. So what we did next was utilise the next Health Science Group annual meeting in Glasgow to run an interactive workshop on the wording of the principles and the opportunities for action. And then we took these to a broader network of the U21 via a survey. The consultation results in the final principles were endorsed at the U21 President's meeting in May 2020, and the declaration was then launched by the Health Science Group meeting later that year in Dublin. If we could just change to the next slide, please. So just to run you through what the declaration principles are, the first one, that the university and everyone in its community commits to its role in creating, promoting and sustaining a positive environment for optimal mental health and wellbeing amongst its staff and students. So very much taking more of a preventative lens there. The second principle, going to what Samson was saying about the importance of students, that students and staff in this instance are the heart of our concern and what make universities thrive. So therefore, all discussions and delivery of improved services around mental health must consult and engage with these groups. The third principle commits the university to its role in linking staff and students who require additional support for their mental health to professional and evidence-based mental health supports, either on campus or off campus. If we could just go to the next slide, please. Principle 4, one of particular importance for us today, as it'll be the focus of the presentations you're all about to hear, is for the university to facilitate the building of an evidence base through monitoring and evaluating the need for and the outcomes and effectiveness of all mental health and wellbeing policies, programs and services that are being delivered by the university. Critical role for universities to build the evidence base. And the final principle was that the university takes seriously and will address promptly any prejudice related to mental ill health and will endeavour to foster a stigma-free environment of support and understanding. Since the declaration was endorsed in May 2020, we have continued to meet through a mental health working group as part of the U21 network. And we've utilised the health science group meetings in particular every year as a way to keep mental health on the agenda. And we're always looking for opportunities to collect and share good practice across the whole U21 network of universities, such as opportunities like this. So if you're interested in more information, there is a dedicated page on the U21 website, which we can send to all the participants after this session. Thank you very much for your time and support here today. I'm looking forward to now hearing more about the excellent work occurring across U21 universities that's supporting us to build the evidence base as per Principle 4.
Thank you, Vivian.
Thank you, Vivian, for the sharing and a little background. I guess for those that weren't that familiar with the declaration, this provides a really clear background of how this declaration has came about and also provides a better context of what you'll be listening in today's session. And I guess for those who are really very familiar with this, it's a little refresher because these principles are really core to the work that we do at universities. So before we proceed to the lightning presentation, we'll be sharing with you a short video prepared by students from the University of Johannesburg, where they ask their peers in their university what their thoughts on their mental health and their services are. So we can watch the video.
As part of the mental health initiative, we will be talking to students around campus, finding out if they're using our facilities such as PsyCAD or using the 24-hour line to actually get their mental health well-being taken care of.
I prefer taking things on my own.
Taking things on your own.
Yeah, because my religious background, cultural background, it's easy. So much is
Yes, I know them. I know there's PsyCAD, which deals about mental health. If like you're a student suffering on any mental.
Have you used PsyCAD services?
No, I know they do offer like sessions for students suffering from mental issues.
Well, I do know about PsyCAD.
Have you used PsyCAD services?
No, I haven't. I haven't really needed them.
Okay.
It's still my first year, so.
Okay.
I also think that you can also speak up maybe to a therapist or a friend. And I also believe physical exercises can also help you cope with mental health issues.
Have you been there before?
I haven't seen it, so I deal with my stuff.
What would you recommend to make PsyCAD better?
I think maybe more flyers or something that keeps the talk around
Visibility.
Yes, I do.
Have you been there before?
No, I haven't. I don't think I've gone through anything that might help me to go there. During tutorials, maybe have someone to let them know that university does get a bit hectic and doing a lot of things alone. So someone to just tell them where the place is. Obviously, we already do that.
Personal issues together with academics. I felt like I needed PsyCAD.
When you have problems or maybe you are stressed or something, that's all. Yeah, that's good.
How was the experience?
I went there, I had problems with I couldn't manage my time, so I went there with my friend.
PsyCAD is like a place or like an environment where you can be comfortable and like talk about your feelings, whatever stressing you, be there with someone to help you go through something. Even for education, I remember they told me that if you're struggling maybe with the course, you can get someone to like help you with their work, your studies, and stuff. Have you been to PsyCAD before? And how was the experience? It was good. It worked for me.
So that was some sharings by some students at the University of Johannesburg, and I'm sure we kind of experienced something very similar in Hong Kong, and I'm sure probably in other universities too. We have a service for mental health and both for student and staff, but some students might not even have heard of these services, or maybe they have heard of them, but they don't feel like it's something that they want to go to. So this is also where I think the principles that we talked about earlier, the whole youth and staff involvement, and also setting up an evidence base where we really can both monitor and also evaluate how well these services are doing and whether they're really targeting the needs of these students is really helpful. So right now we'll be having our lightning sessions, and I'm sure you're all been waiting for this moment. We'll have Professor Barbara Dooley all the way from Ireland to be chairing the session. She is from University College Dublin. She's a professor of psychology and also the Dean of Graduate Studies at the university. And she's also now the president of the International Association for Youth Mental Health. And a lot of us know her as one of the leaders in the fields of youth and student mental health. And not only is she very passionate in this field, but she also puts a lot of emphasis on youth involvement and participation. So she is really the best person who can be chairing the session. So let's welcome her on the stage.
Thank you very much for that kind introduction. I think I don't think I quite deserve all of those comments, but many thanks. And I'm absolutely delighted to be here. And thanks to you and to Gloria for the invitation. And Viv, hi Viv. Oh no, I can look this way, she can see me. Who's another colleague of mine in Melbourne, and I'm really delighted to be here to hear, because I think this has been going now for a number of years. It's really only 4 years, but there has been great momentum. We meet regularly online. I know we'll get to the lightnings in a moment, but there is a huge engagement online to try and promote sharing of practice, sharing of thinking, sharing of how we can promote the mental health and well-being of our students across the community of U21 university members. So I was absolutely delighted and very pleased to be on campus at the moment for the annual meeting and to be able to be here in person with you to talk and to chair the lightning sessions, because looking at these, I'd say we have a number in person and we have a number online, which is fantastic. And I'm also delighted, a colleague of mine from UCD will be talking very shortly. And I'm going to keep people to time because we said we will chair this very much. So each of our speakers will have 5 minutes, and I'll be a little bit brutalist if they start to go over. I was saying time to leave the stage. So we're going to start off with our first session, which our first input for our first lightning, which is online from the University of Queensland, and is the development and use of a wellbeing engagement and research culture with the acronym WERC, Survey for Australian Higher Education Research Students. And we have Antje Martins from the University of Queensland, who's going to take us through this presentation. So over to you.
Thank you so much. Thank you. Hello and welcome from Brisbane, the east coast of Australia, from Turrbal and Yagara country. My name is Antje Martins, and I would like to thank you for allowing me to present on the development of our Wellbeing Engagement and Research Culture Survey on behalf of our project team here at the University of Queensland. Next slide, please. I'd like to start really with acknowledging that the academic mental health crisis affects all levels of academia, faculty, postdoc, early career researchers, and doctoral students. However, really, considering that doctoral students are the future generation of researchers, we feel that it is in our best interest for the betterment of our academy to really create a supportive environment that allows doctoral students to thrive and to enjoy the start and the length of their academic journey. Next slide, please. So here at the University of Queensland, our research has been instigated to the results we received from the Postgraduate Experience Survey, the PRESS, and the Postgraduate Research Experience Questionnaire, the PREC. Pre-COVID, really both surveys indicated that our doctoral students were not satisfied with the research culture in their departments, the inclusion, the feeling of inclusion, the feedback they received, the progression throughout their degree, and so forth. So this really led to the creation of our WERC project group, essentially. The project was really initially set up to be a student and staff partnership project. So these projects are intrinsic to UQ and they're supported by the university. They're set up so that students and staff work together so they can together enrich the university experience. I initially was a student partner on this project, so I'd like to share a little bit about the experience that I had on this project today with you. So when we started back in 2020, our project team had 6 professional and academic staff from different faculties and 6 doctoral students. And all of our doctoral students, including me, we were from different faculties and at different stages of our candidature. I, at this stage, particularly was halfway through my candidature, and at this stage already had experienced some challenges with well-being through COVID, but also prior to COVID. And I've seen a lot of my doctoral colleagues really struggling with their well-being throughout their journeys as well. So as a team, we met weekly to develop really a survey to assess doctoral candidate well-being. So we draw from the literature, we drew from the insights that we received from the PRESS and the PRAC, to determine the most suitable measures for well-being, but also to predict what could cause good and well-being and mental health. And that was more so guided by our team's knowledge and experience. And again, the team included students as well as staff. So we ended up including support resources, HDR life integration, research culture, career, and identity. Personally, from my time on this team, I really remember that I felt seen and heard like I never had during my entire doctoral journey. It really was amazing to see all these people from different backgrounds coming together with different opinions, and we worked together beautifully without conflict. And there was a willingness to listen to each other, staff and students, and to understand each other. So the academic staff I've worked with were really great role models. And I also felt more capable as a budding researcher coming out of this. More than anything, I think, and that's the main point here, is that the resulting survey did not reflect what academic staff thought needed to be surveyed. It actually reflected what we as doctoral students, so expressing by the voices of the doctoral students on our team, thought was important to understand for doctoral students' mental health and well-being. So there was an inclusivity in survey design that resulted in some really interesting insights within our study. Since then, as some time has passed, the survey has been amended, the team is a little bit smaller, and I've recently been conferred as a doctor, finally. The survey has now completed its third and final round, and soon we'll be able to report longitudinally as well on doctoral well-being and associate factors. Through the years, however, the results of the survey every year have been used to set up a working group dedicated to doctoral student well-being. I'm part of that working group as well. And the group has really helped to redesign processes and provided more guidance and resources for doctoral students. So we now provide a guide to our doctoral students on how they can discuss expectations with advisors. There was a revised milestone process, and the presentation that are part of the doctoral milestones now are seen more as developmental opportunities rather than really assessing research quality only. There's more training for students and staff and advisors on mental health as well. And there is discussions around creating really communities of practice on how you can support or how advisors can support doctoral students throughout their journey as well. Next slide, please. So I hope A, I stuck to time, and B, I hope this short talk really invited you to think about how being inclusive at the research design stage can really provide better outcomes for the research population. Please do connect with us, with the team, via our email, and you also have a QR code for a website on here as well. Thank you.
Thank you so much, and for keeping to time. Fantastic. And I think that's really excellent to hear about doctoral research students who are often maybe added on and not really thought about as much in terms of mental health of students. So that's excellent. We're going to move now to our next presentation. And this is we're going to have Michelle Lee from the National University of Singapore, who's in person. And it's going to be improving staff wellbeing and assessing impact, how we did it in the National University of Singapore. So I think that's fantastic that we have somebody talking about the staff perspectives. This really begins to speak to the U21 declaration. You'll see the inclusivity of both students and staff.
Hi everyone, very happy to be here. I'm Michelle from the National University of Singapore, and today I'll be sharing more about how we improve our staff well-being as well as how we assess impact. Next slide, please. So just as a quick introduction, previously we uncovered significant levels of mental distress among staff, and many of them have also stated multiple barriers cited to access mental health resources and services being provided by our school. We subsequently then spearheaded various wellbeing initiatives to improve resource awareness, as well as to really drive a culture of psychological safety and empathy for our staff and students. Next slide, please. So to kickstart things, we had our annual destigmatization campaign starting from 2021, and we've been taking our NUS community on a mental health journey, really helping them to understand mental health, being open to talking about it, as well as to support others in need. And this is some highlights of our campaigns. We had panel discussions to encourage open conversations. We also developed digital games where you can participate and then win interesting prizes. We also rolled out various wellbeing workshops and activities. And to reach out to the wider mass, we had presence on social media, as well as on-campus awareness and electronic mailers to reach the news to all staff and all students. Next slide, please. So what then is the impact of our campaigns? And we find that with consistent annual destigmatization campaigns, these are really effective in reducing mental health stigma, as well as to promote a psychologically safe space. And I'll share more about the impact in the next few slides. So first of all, we look at depressive symptoms via PHQ-2, and we find that both staff and students had improved the frequency of depressed mood post-campaign. Next slide, please. We also look at personal stigma scores and find that both staff and students who have heard of the campaign had significantly lower personal stigma scores. Next slide, please. We also look at social distance scores, and staff and students who have heard of the campaign had significantly lower social distance scores, meaning that they are more willing to be close to someone who have mental health issues. Lastly, those who are aware and have taken part of the campaign are also more willing to use the resources as well as to help or support someone else with poor mental health. Next slide, please. So other than awareness building via campaigns, we also tried to build an ecosystem of support for staff requiring different levels of care. So next, please. Yeah. So first we have wellbeing website with resources for staff and students to really self-direct their learning. Next. We also train staff to be peer supporters so they can better encourage and help their colleagues in need. Next. We also develop a guide for managers so that they can better support their staff. Next. And for those who require further help, they can then approach our clinical psychologists or what we call the wellbeing specialist partners. And if they feel more comfortable approaching someone outside of NUS, we also have an employee assistance program that they can tap on. And next. And for those who require even higher levels of help, we will then route them to appropriate external specialist care. And all these are bolstered by our various initiatives under these different areas, such as culture and strategy, where we have a dedicated mental health committee. And also we hold leaders to accountability via KPI measures. Under systems and infrastructures, we have things like flexible working policies as well as training for managers. And lastly, for support services, we provide such support services in terms of financial support, for example, with mental health insurance, as well as job reintegration skills. Next, please. So then with everything in place, how do we then measure the overall impact? And we do so by associating various mental well-being metrics, such as positive functioning, which is measured by PERMA, compassion, site safety, etc., with different employee metrics, such as their sick and annual leave, as well as attrition rate. Next, please. And here are some of the key findings. So first, we find that relationship correlates most strongly with psychological safety. And what this means is that staff with good relationship at work experience more psychological safety at work. Next, please. We then look at departments that provide mental health resources as well as implement activities and programs for staff. And we find that staff who are in these departments had higher PERMA scores than those staff who belong in other departments where their leaders do not provide such services for them. Next. We also find that meaningfulness negatively correlated with regrettable attrition. And what this means is that staff who experience higher meaning at work are less likely to leave the company due to dissatisfaction. Next, please. Okay, so in conclusion, what we found is that with consistent destigmatization campaign, and these are effective in reducing stigma as well as promoting a psychologically safe space. And because we know that staff with good relationship at work experience more psychological safety, we thus need to facilitate a supportive work environment. Staff with better mental health support have higher PERMA scores, and this really demonstrates the significant influence that department levels leaders have on employee well-being. And last of all, in order to reduce the likelihood of regrettable attrition, it is important for us to periodically remind staff of their meaning and their impact at work. Next. And that's all from me. Thank you very much.
Excellent. A lovely study and some very nice statistics. I like statistics, so I enjoyed that very much. Many thanks. So we're going to move on to our third talk now, and the next two are going to be online. So the first of these is from the University of Melbourne, Melissa Russell, and the title of the presentation is Combining Routine University Data and Research Data to Evaluate the Effect of Assessment Design on University Student Mental Health.
Okay, thank you very much. I hope you can hear me okay. What I'm going to be talking about is how we've combined our data, some research data that we have. We've also utilised the routinely collected university data into our study as well. So we can have a very detailed look at the effect assessment can have on university mental health. And so first of all, I'd like to thank the quite large project team on this. So this is an example of what we wanted to do. We were interested in the effect of assessment design. So, for example, whether it was an exam or written assessment, whether it was a group assessment, how much weight did an assessment have, whether this had an influence on student university mental health. And the reason for that is, I guess, that in the background, we have seen previous research that we know that high stakes exams, for example, seem to have a negative effect on student mental health, but we wanted to look at this in greater detail and look at different aspects. So here's an example of two of the questions out of many that we asked in this project. This one is a higher percentage of assessment weight, for example, high stakes assessment in an examination period associated with longitudinal increase in symptoms of anxiety and symptoms of depression. Another one that we asked was, is a higher percentage of assessment weight as group assessment also associated with a longitudinal increase in symptoms of anxiety and symptoms of depression? But as I said, this is just two of the many questions we asked. So perhaps next slide for me now. Thank you. And so what we had data from research data from 2019. In this survey, student survey, we measured university students, their depressive symptoms and anxiety symptoms. Then we followed the students up 18 months later, and we asked them again about anxiety and depression. So this was in 2020. We had approximately 2,300 students able to take part in this component of the study. Well, they didn't take part. We were able to utilise their data from the research project. And what we were looking at was change in time from baseline to follow-up. What we put in the middle of our research project was what is in the orange here, is that we linked each individual student's research results, so their mental health, to the assessments they had taken over those 18 months in between the first measure of mental health and their second measure of mental health. And so we did this using routinely collected data. So we included in our analysis 6,723 subjects and almost 20,000 assessment items. And from that data, we were able to create a kind of assessment experience for each individual student. So this was the number of exams they had, the number of group assessments, the weight of exams over those 18-month period. And the data that we used for this, and I can show you, so next slide, just click through for me to the, keep going. Click, 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 click. Thank you. And so, no, too far, back one. Thank you, that one. And so this is the data that we used, and this is the routinely collected data on all assessments that are conducted at the university in each of the subjects. And so in this example, this subject has 4 short quizzes, a video presentation, written assessments. And so we collated all of that information for each of our individual students. And really all this routinely collected data just sits behind a spreadsheet in universities. So next slide for me. So by incorporating this routinely collected data, we were able to have a look at the effect of assessment design on student mental health over time, so change in mental health. In this first graph, what we can see here, symptoms of anxiety on the y-axis, weight of assessment on the x-axis, and we can see that above a weight assessment of a weight of 30%, there is increasingly symptoms of mental health or increasing symptoms of anxiety with an increasing weight of assessment in an examination period. So here we're talking high stakes assessment. And we saw a similar trend as well in looking at symptoms of depression. And so the goal, I guess, here was to really, I guess, to look at assessment, but also to start to use that routine collected data that the university produces, because there is so much of it sitting in there's so much of it sitting in the system. And so now, for example, with the assessment data that we have a program now that can run just to clean that data yearly. And so we can keep running that program. Okay, thank you for listening.
Thank you very much. Excellent. And again, another time. That was very interesting use of data and assessment, and the importance of considering assessment and assessment load and the mental health of our students. So we're now going to move to our next presentation. So this is from my colleagues in University College Dublin. Lovely to see Niamh online. Embedding wellbeing training in the first year veterinary curriculum at UCD. And the presenter is Niamh, but you also with the colleague Pamela Kelly in UCD. So I'm going to hand over to Niamh.
Thanks very much, Barbara, and lovely to see you. And good morning from Dublin as well. The sun is just coming up here. So thank you for the lovely introduction, and I'm really fascinated to hear all of the presentations as well. I'm taking loads of notes here. My name is Niamh. I'm the student advisor in the School of Veterinary Medicine in University College Dublin on the east coast of Ireland, and I'm here on behalf of myself and my colleague Pamela Kelly, who is our faculty lead for the professional development curriculum as part of the veterinary medicine programme in UCD. So I'm going to talk to you today about a positive mental health initiative that we've launched in the last year in the veterinary medicine programme in University College Dublin. And if you don't mind moving on to the next slide for me, thank you very much. Thanks, Melody. So first of all, why have we done this and what does the research evidence show? So over many years, the veterinary profession has really been looking inward at itself in terms of mental health distress and mental health issues within the profession. And what the research has shown is that there are very high levels of anxiety, depression, and burnout among veterinary surgeons and veterinary nurses in practice. So those who are showing compassion for our animals who may be unwell in our homes, in our fields, and in our yards are themselves experiencing high levels of compassion fatigue and all of the associated issues that come with that. The statistics as well on suicidal ideation and suicide are actually quite worrying for the profession. So research would show that there is about 4 times the level of suicide within the profession as the general population, and twice the level of suicide than other healthcare professions. So the Veterinary Council of Ireland in 2020 commissioned a survey on the profession in terms of mental health issues. And what the survey showed was that mental health and mental health distress was the most important concern for the profession currently. UCD has the only veterinary medicine programme on the island of Ireland, so it was very important for us to include mental health training and wellbeing training for students earlier when they're students, before they graduate and go out into the profession, so that they're equipped with the necessary skills and knowledge and awareness to protect themselves. So we see this very much as a protective factor. If you don't mind going on to the next slide, I'll just explain how we did this. So between 2020, the publication of the BCI report, and 2022, we worked very hard to identify a suitable programme that we could include for students. We identified some champions from the student affairs departments and faculty within UCD, and we prepared a pilot curriculum project together with the Health Service Executive in Ireland, the National Office for Suicide Prevention, and the National Suicide Research Foundation. What we did as well was part of a collaboration, or as part of the Higher Education Authority in Ireland. They're currently rolling out their national mental health and suicide prevention framework across higher education in Ireland. So this programme sits under that. Between October 22 and May 23, we identified a programme we could include that was developed originally by the Health Service Executive in Ireland, and we adapted that and adopted it within the programme. We made it suitable for the student group that we're dealing with. Later that year, in 2023, we recruited and trained facilitators from right across the university, from faculty, professional staff and technical staff. So we opened up the call to anybody who was interested in being involved in delivering the programme with students. And then in September 23, so just last trimester, we rolled out the programme for the first time to our 90 first-year undergraduate veterinary medicine students. We surveyed the students pre-delivery of the programme and post-delivery, and we're currently in the analysis phase of the data that are coming from that survey. We've also recently conducted a focus group with some of the students, and preliminary analysis at the moment is showing that there has been a positive impact of the programme in terms of the students' knowledge and awareness of their own mental health and the adoption of some strategies that they can use to actually support themselves, particularly if they're experiencing stress and anxiety. The students in the focus group in particular stressed the importance of having a programme like this as part of the curriculum, and having it within the curriculum gives it real weight in terms of its importance. So that's where we're at the moment. Watch the space. We're preparing for delivery of year 2, and we're also preparing for the delivery of this programme again to first years who are coming into the programme in September. So next slide, and a very big thank you. Here are some references if you'd like to follow up, and our contact details as well. And I see I'm just at 5 minutes. Barbara, thank you very much.
Thank you, Niamh. Yes, yes, you're under your 5 minutes. Many thanks. And I think it's another, as you see, each of these presentations are different, but also really important parts of what we can do. You know, there's so many ways we can impact the well-being of our students and staff. So, and I'm delighted that we're getting to see the different variety of things that are being done across the network. So we're now going to move to our final presentation, which is an in-person presentation. So this is Elise Fock, am I correct? From HKU, and Elise is going to talk about the holistic well-being of undergraduate dental students, finding and future directions. So I'm going to hand over to you.
Hello everyone, I'm from the University of Hong Kong, Faculty of Dentistry. My name is Elise and I'm a final year dental student. Our project is supervised by Professor Michael Patello, and we have a few of my group mates, Charlotte, Rosaline, and Ophelia. Next slide, please. So I'm going to talk about how does well-being and dentistry tie together. So dental students are a little bit more prone to poor well-being from academic and clinical stressors, and also financial burdens and personality traits. And then recently, there's also the high impact of COVID that has worsened dental students' well-being, because there is a lot of reduced clinical exposure. There's a lot of reduction in social interaction and disruption in routine and expectation. So why is well-being important for dental students? As we're all educators or students in here, poor well-being impairs learner confidence and also academic performance and the enjoyment of the course. Well-being also leads to better patient care. There's study that's shown that dentist burnout was found to lead to a twofold increase in procedural errors, suboptimal care, and lower patient satisfaction. So if the students is reflective and be able to understand and embrace well-being, they can also develop greater empathy to their patient. Last but not least, it's also important about the sustainability of one's professional career. There's a study in the UK that has found that mental health deteriorates throughout the dental school and also continues to decline after they graduate and enter the workforce. So it's very important to teach them about healthy coping skills. And also poor well-being among dentists is associated with increased risk of substance abuse, suicide, and early retirement. So the aim and objective of our study is to develop a suitable questionnaire to evaluate dental students' understanding and experiences of well-being, and also to investigate and analyze the factors affecting dental student well-being, and to develop a student well-being action plan based on the results of our survey. We have developed our own questionnaire because most of the existing literature focuses on the lack of negative symptoms, which focuses on anxiety, stress, and depression. According to the WHO definition of health, it states that a state of complete physical, mental, and social well-being, and it's not merely the absence of disease. So that leads us to develop our own questionnaire that focuses on 4 well-being domains: emotional well-being, physical well-being, intellectual well-being, and social well-being. Our survey is in 2 parts. Next slide, please. The first part of our survey focuses on individual experiences of well-being. Our survey has a response rate of 71%. The N number is 321 out of 452 students filled out the survey. And then we conducted follow-up interview for 6 students. So from the first part, most of the BDS students show a low level of overall well-being. 2/3 of the students skip meals to rush the class, and over 70% don't get enough sleep. And 60% of the student had concern about passing the year and meeting the required clinical standards, and 70% fear falling behind, and then 3/4 don't have enough time to pursue hobbies or other interests outside of dental school. And these results are worsened with increasing year of clinical study. Senior clinical students are having more occupational health hazard like back pain and neck pain, and they're less looking forward going to school and take longer time to overcome mistakes from exam and clinical performances. But although a majority experience positive relationship with peers and their tutors, less than 1/5 of the student find well-being being supported by the faculty. Next slide, please. And in the second part of our survey, which we collected feedbacks on the proposed well-being initiatives, the student found the following activity in each domain were the most beneficial. So for physical and emotional domain, they find collaboration with the University Center for Health and Exercise and introduction to stress reduction, mindfulness, and meditation to be helpful. These might also help with stress reduction and managing those musculoskeletal problems identified earlier in the survey. As for the social well-being, we have identified the buddy system, which is a mentorship program that pair the senior student to the junior student. It's an initiative that we have started already. And then, yeah, so student will also want more training on the patient communication part. As for intellectual well-being, we have identified that student want the survival guide. So we have also developed a survival guide. Could you click 2 times, please? Yeah, so we have also developed a survival guide that we have disseminated to the freshman year student that could help them survive in the BDS life and also survive as transitioning into clinical years. So in conclusion, as the saying goes, like social media is not what it is in real life. Similarly, what we've seen on the outside might not be true to what's happening on the inside. A student might appear to be very high functioning, excelling in the dental career, but it doesn't mean that they're not struggling internally. So we need to ask and give students the support and training for them to develop the skill to maintain a good well-being during dental school and also afterward as a practicing dentist. Thank you.
That was such a nice presentation by everyone. We had a bit of a technical difficulty in the beginning, but I think you know, being able to really hear all these presentations both in person and also abroad from our colleagues in Australia and also in Ireland, it was really nice to see what everyone really is doing. So right now we're going to our last bit of today's session. We'll have our fireside chat with our presenters today, both in person and online. So can we welcome Professor Barbara Dooley and our presenters, Elise Falk and Michelle, and also our student representative Yanni up on stage to join the discussion. And for today's session, this will be led by Professor Sherry Chan, who is the Clinical Associate Professor at the Department of Psychiatry at the University of Hong Kong. She's also a co-chair of the U21 Health Sciences Mental Health Working Group, and she has been doing several studies on university students' mental health, and she's also a co-principal investigator of Hong Kong's first territory-wide intervention for young people that is really designed for and by young people.
Thank you, Stephanie, and welcome all to the online participants and our on-site participants. So this is a fireside chat. So although we don't have a fireside, we don't have a fire, so we all try to imagine there's a fire there. So I think a fireside chat means that it's a casual discussion, and it's supposed to be close and warm. And I think, so first of all, I'd like to invite all the participants online and of course here to think about the questions after all the very inspiring sharings from all around the world. Feel free to ask any questions or leave any comments, and then there are times for all of you to talk about it. So I think just after this talk, I was very excited about all the excellent work that has been done in many different parts of the world. And I think 5 minutes seems to be short, but really, really very concise and succinct. And then we can see that many of them, or all of those talks, were actually show off the importance of providing evidence in developing and evaluating the interventions in the universities to promote mental well-being and then interventions for our students as well as the staff. And I think some of them, I can see that it's really a long-term project taking up from a postdoc level to a staff period. And then I can also see there's some longitudinal. And I think it shows us we can learn a lot of different approach, for example, coming from using existing data, combining with research data to evaluate the conditions of well-being in the university. And then also from our Singapore colleagues, very exciting programs and really very inspired because your team taking on a huge project, working on the whole university and trying to really tapping on changing culture. I think that's very brave and really very much needed, and that's also one of the key declaration of the U21. And I believe that this is ultimately all universities should be really aiming for, the changing the culture. And I think the psychological safe space, I really like the term. And I think creating a lovely and nice environment and providing psychological safe space for all the staff and students are really crucial. And as well as the agency campaign too. And I think some of those I can see that some of those programs or faculties or specialties like dentistries and that high risk to some extent, but actually I think for professionals that actually needed to look after others, potentially might need more strength for themselves to actually to be able to look after others. So I think that also reflects before we try to look after others, we have to look after ourselves. So self-care, I can see that the little pyramid, self-care is always the bottom of our programs, and I think that's illustrated very well the steps that we needed to work on in terms of developing the university mental well-being programs for all. So after I try my best to summarize all the programs in short, give a short summary of all of that excellent talks, I think it's time for all of you to actually join in and to have some discussion. So let me first inviting all the presenters. I can see all of you are there on our Zoom. And it'd be great if you can, I'm sure that all of you are very excited about all the other talks from other colleagues. So I'm wondering if you can all give a very short comments from your experience of today's talk. Shall I just invite, perhaps I just follow the order of the talks. May I just invite the first speaker from University of Queensland? Yes, Dr. Martins.
Yes. Hello.
Hello.
Thank you very much. I think they were all really wonderful presentations in terms of the bandwidth of mental health and well-being and its importance, I feel. The one thing that I picked up, which was quite interesting, is that a lot of different programs claim that their programs have a lot of challenges with mental health and well-being, and they're all very different programs. They go from veterinary medicine to dentistry and so forth. So I think the broader challenge that we see is that I think there is just a mental health crisis in academia, starting from all types of different students, regardless of their program, undergrad, postgrad, doctoral students to ACA staff and faculty as well. So I think there's an overarching sort of question about what can we do overarchingly about this, and how can we overarchingly look into solutions to fix that crisis that we call mental health crisis in academia. And I found that really interesting, that I think we saw aspects of across all different levels today in every single one of those talks.
Thank you so much, Dr. Martins. May I invite the speaker from the second talk, please? Thanks. First of all, thanks for the invitation to come to speak. I think it's really exciting to hear. I think one thing I noted just now was also how a lot of the initiatives we actually built and blossomed over the last few years, and I think that really came about with COVID, and that really brought a lot of conversations here, so we can all speak about it. And I think that is actually a happy problem, because with more open conversations, that can also lead to greater health city, as well as more of us to really embark on initiatives to help both staff and students. That being said, I think it's also really important to go upstream and preventive work. So really before any one of us really tip over to becoming unwell, I think a lot of our projects here and initiatives here also really focuses on upstream preventive work. And I think that that's something we could see. Indeed, I think that's what we should all to aim for to make the upstream preventive interventions all work. So can I invite our first speaker, Melissa?
Yes, thank you. So yeah, really interesting presentations, I thought. I was just really, I think, reflecting on the different population groups that were studied, and it was quite wide ranging. It was really good to see the focus on staff and also graduate students. And yeah, I would agree that it is probably wider than universities, the increase in mental health issues that we have. And I think the systemic approaches are probably places that we need to go at our universities to approaching these issues and really looking at how we do things generally and overall that we think are standard. It is whether we need to really think about, is business as usual actually suiting the needs of our students and staff anymore? And I think that's the question we probably need to ask. And yeah, they're all great examples. So thank you.
Thank you so much. Indeed, trying to make a positive change is really another challenge for all of us. Can I invite our fourth speakers? Mia?
Hi, how are you? Thank you very much. Yeah, just like Melissa said, the presentations are amazing and I've already learned so much from this morning. I was thinking a lot as everybody was speaking about the importance of education and awareness raising to challenge assumptions and fears that people might have. I know Michelle, I think it was, that talked about stigma and destigmatization, and I just found that really interesting. But mainly, I think the presentations this morning reminded me that human beings have an amazing capacity to learn and to change and to thrive in the right conditions. And I think universities, we have this golden opportunity when students are in universities to help them with that, and also to help them prepare for a better future for themselves. I think we do a lot of work around encouraging people to speak out and ask for help. And I do think this generation of students very much is doing that. And I think we have to bear in mind that any changes we make, it's really important to include the student voice as well. So nothing for us without us. We need to remember that and bear that in mind. And I think it was Antje who said that, you know, students need something that staff don't think they need. So it's very important for us to always keep the student voice at the center of what we do. Thank you.
Thank you so much. I really share your thoughts, and I think another very unique human nature is that when there's a problems, we will need to try, or we tend to try to work together as a group and collectively. And I think it's always better to be collective and joining efforts and forces and abilities and resources all together to tackle any issues that share with all of us. So can I invite our last speaker? Yes.
So thank you for inviting me here. It's quite interesting to share our view as a student as well before I graduated in school. I think as I've mentioned, it's really useful to raise awareness, and also it's very important to destigmatize mental health. And also, as you mentioned, for profession that we need to take care of people or animals, we also need to take care of ourselves before we go beyond and involved for our patients. So I think that's really important to keep in mind, and also to develop the coping skills and how to excel in our career.
Yes, thank you so much. So now it's time to open to more people, but before that, we're still collecting, so feel free to write down any questions on the chat and then, or think about any other questions. But before that, can I invite Simpson to give a short comment?
It's not in comment, but I have one or two questions I want to see. I was very impressed by being able to cover so many topics in such a short time, so super amazing. I think one or two questions really interest me is first one going to Michelle from AUS. I'd love to hear more story about how your university try to embark on tackling staff mental health. I guess what I'm saying, not sure whether the audience share. I think we tend to put the focus on student, but talking about staff, I think it's quite a different business. So two questions. Number one, how do you turn it around? And number two, do you have the observation by the time you look after staff well, actually students are also doing well? I mean, that would be my assumption, that do you have data or do you have any observation
Thanks for the question. I think first of all, yes, I think rightly pointed out, a lot of us when we start out on looking at well-being at universities, a lot of us tend to focus first on the students before we go on to the staff. But that being said, for us and we as a staff also holds a really huge population, and a lot of them also have interactions with students, which is why we view staff as really important to look after and take care of. And I think some of the things on how we started out doing so is also recognizing the importance of having a dedicated team to really look at staff well-being. So for example, a lot of the other organizations, companies, or even universities that we go out to actually have a chat with, we find that a lot of them will pack it under, say, HR, for example. Yeah, but for us, we really set up a dedicated health and well-being team to really look at both student-facing services as well as staff-facing services. And that being said, we also have a lot of strong support from management to really walk the talk. And I think that's something that really drives the culture also. So for example, our deputy president of administration, which we report to also, would then really take the step to walk the talk and send newsletters, really regular newsletters out on well-being to all staff, and even things like when we have activities, well-being activities in universities. All our leaders will actually come down and really participate in these activities also. So I think having leaders to walk the talk and drive it really drives the culture. We also have different levels. I think just now I shared a little bit about how from awareness campaign, that is one thing, and we also go into all the different services, really training staff to be peer supporters, to support other people in need. As well as training managers, because they also could be the first line of support for staff. And also external visitors, because some staff may not feel so comfortable to approach someone internally, because as much as you try to reduce stigma, there is probably still a certain form of stigma that employees may have, which is why we have external services that they can have also. We also work very closely with other departments, such as HR, as well as our infrastructure office of infrastructure, to really set up a whole services, the infrastructure, as well as the whole ecosystem of support. Okay. So everything coming together, we provide really supportive varieties. As to the second question, I think you were asking about whether or not there's any current data on whether there's correlation between staff and students' well-being. As a moment, but I think that's a really great suggestion. What we have now is really measuring staff as well as and certain departments, whether or not they provide any well-being initiatives, and then how that affect the staff itself. But I think that the area of whether staff and students have any correlation between the mental well-being is something that's really interesting and something that we further explore.
Any critical incident to drive the change that you don't want to share? I wonder.
Critical incident meaning, sorry.
For example, did you get some data or reports? Hey, 1% of staff, they actually have serious mental illnesses like that. So really, I think my question is whether there is a great incident and they turn around and take a decision. I think where I come from is if you are able to share with us, perhaps we can watch out and see whether those are warning signals we should look for, because I think we'll hear from you.
I guess maybe just to share a little bit first about the impetus of why we even started on all of this. Our department was really formed also in the thick of COVID. We ran a campus-wide survey, and then we found that many of our staff are actually showing signs of distress during that period of time. So that was really the driving force for us to really set up the department to then drive mental well-being initiatives. That we say we also have our annual well-being data and survey that's going out to our staff. So we do track on a year-on-year basis on the different metrics as well as different mental health indicators. And from there, we can then see what are the different gaps and we can better target it and better target our campaigns as well as different space of these gaps. Any other questions or comments? Yes, please.
Then I'd love to hear from Melissa. Melissa, you talk about Melissa, you talk about the regularly collect data, such as the weighting of the assessment and also group versus individual work. All sounds exciting. What about regularly collect data in relation to, for example, students late submission, taking long leave, or somewhat consistently underperform academically? Do you guys look at those data in relation to some potential mental health challenges correlation, that kind of stuff? I think I asked the question is because HJU is making attempts to do that. But I am told it's very difficult and also very difficult to train the analysis or the so-called machine learning, developing the algorithm. But I'm just asking a question whether you think that there will be usefulness of pursuing the data in that direction. So I guess my question is, what do you think about it? On top of what you're doing, what about other student data we come across?
Yeah, I understand. Okay, yeah, no problem. Thank you. And so, yeah, you're right. There is a lot of student data available out there. So for our project at the time, we asked students whether we could link to their academic data and results for the subjects they were undertaking and the marks that they received. And so 83% of our students, which is a much larger sample size, altogether we had 15,000 students in the initial study, said yes, we could do that linkage. So that's why we could link to their subjects and then their assessments, because their assessments information that I link to is freely available online. Then we also have marks in there too. So that is something that we haven't looked at yet, which would be great to look at. We can't link to things like extensions, special considered, those sorts of things, because failure to submit is there. But other student data we can't link to because we didn't ask for their permission at the start. Some of the data sets that are available say, yes, it can be used for research, and some say there's nothing about it, so you can't use those. So it would just depend on the rules around that data set. And also for our ethics, we can't link the data that we weren't given permission to link to. We also linked to dropout as well. So could look at assessment and whether that had was associated longitudinally with dropout as well. Does that answer your question?
Yes, thank you. Thank you.
Okay, cool.
Thank you. Any other folks? Thank you so much, Spencer. I think that's really highlighting the very two key issues that we're about to talk. Can I invite Rachel from our wellness and you. I would say the talks are actually quite interesting and fascinating on how different parties work together in terms of staff and student mental health, destigmatization, and also positive interactions. I feel like it's a really great opportunity for today and how things are going. Thank you so sorry. So it makes me change. Finally,
Certainly, I suppose for me, I'm a very senior person in my university, and I think we have a lot to do to ensure that the senior members of our university really buy into the importance of supporting staff and students. And by listening to the initiatives that are here across these 5 talks, you can see a lot of this is addressing or trying to identify issues at an early stage. So it's that upstream piece, and I think we have an important role to ensure that we have an environment both for staff and students that is there for people to thrive and not strive. And so I think that's one thing. But I also wanted to make a comment on Gloria and Viv, because without them really pushing for the last year or more and to curate today, which takes time to put all of their 5 minutes, I thought really insightful talks in terms of the importance of the curriculum, the importance of assessment of staff and doctoral students. So all of them together, it really is, it looks at the holistic part of the university journey, even though they are in different universities. And I think we can learn, so it's I think the similarity of the university environment, rather than the differences in where we are situated geographically is what I would take from today. So I would like to thank them in particular for curating an excellent session.
Me too. Really, and then also I have to emphasize our shared appreciation of the support from Alicia. So I think she's also a key member for the team and to make these symposium actually happening. Without her help and then support and organizations, I think it would be very difficult for us. So a big thanks for Alicia. So I see that Vivian has a perspective. Oh yeah, Vivian. Yes.
Hi, I'm just letting you know that there's a question that's come in online as well. If you're happy for me to read it out, so there might be some other people that have some responses to it. But Ikram had a question online. How do you think the stigma of mental health can be combated within university and within healthcare workplaces? How can we change the social ideas about mental health? So thank you for that question, Ikram.
Thank you. The suggestions and thoughts from us or from others. I think I saw this response already. People from staff and early stages and families and communities. Yes, very, very true.
Yeah, if I can jump in here, I think I absolutely agree with Neve, and like that destigmatization needs to start within like an early age and from society, and also the understanding that mental health is no different than any other bodily health. I think that's we made the separation like with our words and our language, that we separate mental health from the rest of the body, and I don't think that's a very healthy one to do. I think if we accept that our brains, our mental capacities are part of our body and how our body functions, I think that is a step towards the destigmatization of mental health and it's being something taboo and bad, really. And also maybe even just the language that we use, like maybe use thriving and well-being instead of actually mental health, or like just change language around that. I think that has a very massive impact as well.
I think I really agree with that. Maybe just to share some information from Singapore. I think a lot of us back in Singapore also find that a lot of us don't think that mental health is important as physical health. But actually, this is already closely connected and should get it holistically.
And also with regard to mental health itself, many of us may also, well, not in the field, may also have the wrong misconception that mental health is just whether or not you have mental illness. But we know that mental health is really across the spectrum. Anyone can get a mental health issue at any point in their lives, they all move up and down on the spectrum. So it is really important for awareness building also to let people know that, hey, there are things that you can do, things that you can learn to cope in times of challenges. And then build it so you have little toolbox so that whenever there's a challenge that you face, you know how to have this good potencies in order to better cope with challenges.
Yeah, I think that's very important. I think also the stigma is one of the biggest barriers to help seeking really for many different generations and people from different backgrounds and it sometimes it makes me think whether separating illnesses and health, mental health and mental illnesses, it might actually make people feel I'm not ill. I'm just having mental health problems, and that just again, so that it's very anti-stigma campaigns has been there for many probably years and many different places have done that. And I truly think that now we still have very limited grasp about how stigma actually developed in our community, changed in our community, varied between different communities, and then how we can actually have some sort of actions to incrementally improve a little bit. What we want to really achieve is culture and also end up making people to really seek help when they really need it to. I think that's really a key thing.
Yeah, so I grabbed the mic so I can, because I have a lot of ideas and questions after listening to all the great and excellent talks. I would like to refer back to our earlier in progress mentioning how wide the topics are and the availability of data from across the board. This a question that has been on my mind for some time is we have this data from routinely collected data, and then researchers like me, Sherry, and many others, we have our own idea of what kind of data we need. And after listening to Elise and many helped us earlier from a student perspective to design specific questions and surveys specifically for university mental health. So I'm just wondering, do you think we can agree on a certain kind of data or information that we need? Because particularly maybe we can ask students and staff's perspective, because apparently there's no perfect measure, no perfect scale. That's why we have these and many you propose to develop your own questions for the investment. So I'm just wondering if there's any future direction for us to better use data to inform the investment. Sorry, sir.
That's a very good question. I know. Sorry, that's a really good question. And in fact, after one of the IUINH conferences, we had a meeting where the great question was not so much on students, but to whether we could get an agreed, let's say, minimum data set across countries and people, so that when we talk about some of the issues that we are comparing as to like with like, and we didn't get very far. The discussion was held, but I think that's a topic that will be very useful, that will be taken forward to see to what extent even minimum number of questions could be agreed upon and share some of the findings on that. So I think that that's something that many researchers have asked and have yet to deliver. That's evading the answer.
So for us, the questionnaire that we developed is maybe more applicable to other health sciences majors like dentistry or medicine and veterinary science. So for the questionnaire that we've developed, we have specific questions such as like, do you find treating patients to be difficult, or do you find treating like interacting with your nurses to be difficult? So after that survey, we actually published this study recently in the Journal of European Journal of Higher Education. So we have attached the questionnaire there. And after that study, we actually have a follow-up study, which is a qualitative study. So we developed an interview guide, and then we're interviewing like final year dental students and see what their emotional well-being is and what their stressor is during the course. But yeah, I think the interview guide and the questionnaire is maybe more applicable to medicine or these.
Sounds like there's a need for general legal data and specific for specific needs.
Yeah, exactly. And I think then we could supplement this, not just about what question or what information, but also how do you present the information. So maybe that's a lot of insight about wordings that students would find offensive or more in the students' language, so we can actually.
I would say that some of the wordings would be like to make it easier for students to understand. Could be some of the slides could be used, but like in a polite form of slides that could be found on Instagram or found of regular conversations, rather than like a very professional way or a way where it might be quite difficult for students to understand. Yeah, more like that. It might be more difficult for students to understand, and with simpler wording to make students like more willing to fill out the questionnaire that is posted online. And I feel like using some cases that are more related to their daily life might be another way out to try to like ask them for more information, might be more interesting for students and they're more willing to answer.
Thank you. So that's how to engage students using appropriate ways.
Can I ask another question? What would all the experts in the pedagogy and also online? Would you guys share any tips, suggestions, in particular, reaching out those hidden, less confident, don't go to any party, don't go to any event students? Do you have any observation? Please love to share your results.
Any thoughts from our online colleagues?
Would you mind repeating the question? Sorry, it was a little bit difficult to hear it. Maybe it's me.
Yes. Maybe just I repeat. Can you hear me? No, not really. Would it be possible to, yes, we will try to write it down on the chat.
First question. The question was on how to involve or ask students that are less outgoing and doesn't really join. That kind of relates to me. I'm very introverted. So for our study, we actually go to the students' classes, and then at the end of the class, we stay there and ask them to fill in a questionnaire. We also have like QR codes, like class messages online, but those doesn't yield a really high response rate. So we find the in-person invitation to ask them to fill out the questionnaire to be the most helpful, especially because for the dental curriculum, we have 6 different clinical years. And each year is divided into clinical groups. So we have like around like 6 to 7 groups per year. So we will go to each group's classes and then be like asking them nicely to fill in questionnaires. And also we find the coffee voucher to be a really good initiative for students. Yeah, for both the questionnaire and the in-person interviews.
Thank you. Maybe I think it's Dr. Martins.
Yes, thank you. I wanted to just briefly share something that I hadn't considered before when we did our studies. We involved the qualitative part as well, where I went out and did focus groups and interviews with our doctoral students. And some of our doctoral students like to call themselves hermits. So they want to be not involved, or they want to only lurk on the sidelines, and that's the best way they learn, and they want to be integrated. So I think when we talk about less outgoing students or, you know, less extrovert students, I think we first of all need to understand, do they really want to be involved, or what is the way, like what does involvement actually mean for them? Because sometimes they actually just want to stay on the outlines. And for those students, COVID was actually really quite interesting and great because everything became online. And by being online, it allowed them to be part of it, because they would never ever gone to anything in person, but because things were offered online, they became part of it because it was an easier way for them to engage. So I think when we talk about involvement, I think we need to first understand what involvement is best for what type of learner, and then figure out ways to involve them that way. So that was just a learning I had. That was when the students call themselves hermit, and that's the best way they learn, I think we should also appreciate that and support that, really.
Thank you so much for the insights. Finally, I think that we had a lot of, not lots, but some discussions, but also very interesting questions and sharings from the colleagues and also presenters on the stage. May I finally invite Vivian to have closing sections and any final thoughts?
Thank you very much. I mean, it's been so terrific to have this opportunity to hear about the amazing work happening across the U21 network. This is exactly what the mental health working group is aiming to achieve on a more regular basis. We've done this a bit with the annual meetings, but to be able to take this online. So again, I just really wanted to thank everyone at Hong Kong University, Gloria, Alicia, Sherry, everyone who's been involved in pulling this together. Thank you so much. Thank you to all the presenters as well. You've been terrific today, both in terms of your presentations and your insights in this Q&A. I want to thank Barbara as well. I think one of my reflections as well doing work in this space, and particularly to answer some of those questions about how you get what we're doing here and bring it to scale across the university, it really requires a buy-in from leadership. It's just so critical that they prioritise this as part of the core business of universities to support wellbeing of students and staff on campus as well. And Barbara is a great example at UCD of someone in that leadership role that's really driven that agenda there and has participated in our work since we started in 2018 as well. So yeah, I just think looking forward to continuing the conversations. We're looking forward to some more deeper dives into the other principles of the declaration as well. Really encourage everyone on the call here and in the room to stay engaged and keep an eye out for those opportunities. But thank you so much, Sherry.
Thank you, Vivian, and thank you all for your participation and joining today. And I look forward to seeing you all in the future. That's the end of the sessions today. Thank you. From the speakers online, thank you.